Good evening, everyone, and welcome to our training. Challenge area, neck, hands, and décolleté with NCTF and art filler. Please welcome our expert for tonight, Dr. Elena Rumyantseva Mathey, dermatologist in Paris, France. Hello, doctor.
Hello everybody, good evening, bonsoir, bonjour, ça dépend où vous êtes. Добрый вечер, мои дорогие, buenos días.
Dr. Rumyantseva Mathey is with us tonight to teach you her various techniques. So if you have any questions, please feel free to ask them on our live chat. I wish you a good evening and an excellent training. And to you, doctor, a good live.
Thank you. Let's go. Thank you, my dear colleagues, to be with us tonight. We have just 35 minutes for the presentation and for live demo, and then we have questions to discuss. First of all, I would like to start with a small, really small, it's gonna last 5-6 minutes presentation, so I would like to ask you to show the slide. The first one. To start my presentation, right, why we're going to talk about delicate areas. I always tell to my patients that these are forgotten areas. So we invest in the body, we invest in the face, but we shouldn't forget that the areas which we also see very often, this is hands, neck, and décolleté. So we're going to speak with them, or speak about them tonight. Don't forget then you see your patient, either to show this scale, either always to mention in the medical file the level of the aging. Like that, you're gonna you can show the result and to compare not only by photos but also by the grade. You can evaluate before and after. According to the aging scale of the hands, we're gonna choose the treatment. Next slide, please. And we will choose our puzzles, which are for you for tonight. This is the best products you can have for the rejuvenation and for maintaining of the skin, of the aged skin. This is the NCTF 135 HA, which you surely knows. This is art filler fine lines based on 20 milligram of cross-link hyaluronic acid MHA 18. This is a pure hyaluronic acid without cross-link with addition of glycerol. We're going to talk about it later. And also with a filler universal. This is art filler universal based on 25 cross-link hyaluronic acid. According to the grade, we will choose a protocol. And on my patient, as far as I have only one patient, I will try to show three different protocols which will help you in your private practice. Next slide. When we inject in the hands, we have to remember that the level of success is linked to the level of injection. When you choose your grade of aging of the hands, then you will have to choose the filler. Please remember that our hands, you all know the aging of the hands, but please remember that we have free fascia, and our goal is to inject just below the skin, and the only way how we can go there, this is through the cannular, and we have to be really close to the deep dermis in the upper superficial lamina, the one you see on the slide with number 1. And you can inject their fillers with low and middle G prime. Like that, we're gonna use fine lines and universal filler, which contains, I remind you, 20 and 25 milligrams of hyaluronic acid. On the superficial level, intradermally, we're going to introduce the product which contains amino acids and vitamins and natural hyaluronic acid, which going to hydrate the skin and then to improve the metabolism of fibroblasts and creation of collagen. Next slide, please. According to the neck, we all remember that the success of the treatment really depends not only on our injectable treatment, which we will, which I'm going to show you today. Please remember that injectables are very good for the preparation for the skin for the future aesthetic procedures like thread lifting, like improvement of the quality of the skin, or lifting with radio frequency devices, or HIFU devices, or even plastic surgery. So this is not the only treatment which we should offer to our patients. Next slide. According to the grade, which you have seen on the previous slide, there are some protocols to follow, and I will introduce you the product which you will use in your practice, but this is a tool. This is not a product itself. It's also linked to Filmed portfolio. This is a nanosoft needle, the unique one, which will allow you to introduce the product on the level, on the most effective level. This is a middle dermis, which contains the highest amount of fibroblasts, and the activity of fibroblasts of this level is the highest one in the dermis. So this tool will allow you to deliver the product without additional forces on the proper level. Next slide. According to the décolleté, on our patient, which you will see a little bit later, we will see the moderate deep lines, and the level of aging scale according to Fadi-Bolden is free. And we will use a special technique which will allow us to stimulate fibroblasts and also to prevent the atrophy of the subdermal fat layers. Next slide, please. I'm sure all of you are familiar with the products and with the classification of the aging. That's why I don't want to stay on the slides more. I just would like to introduce you the practical part. But whatever you do, please remember that the success is not inside just one procedure. Please explain to your patients that everything which gives nutrition to the fibroblasts of our patients should be repetitive. Why? Because we have to deliver nutrition every 2-3 weeks to wait and to be able to have proper the level of collagenegenesis. Next slide. The proper level of the injection of cross-link fillers on the décolleté gonna be the deep dermis. Either we have to inject it in subcutaneous fat. You will see frontal plane cross-section of the area just above the chest. So this is exactly the area where we will inject and where we will introduce our cross-link products. Next slide. Great. Finally we can start, and we will start the treatment from the neck of my patient. I will prepare 2 products, and I will ask you, before I show you the one I choose, I will let you to choose inside the Filorga portfolio the one you prefer, and I will remind you the products with which we're supposed to work tonight. This is MHA 18. This is the MHA 18. This is the Art Filler Fine Lines. We can exchange it with Art Filler Universal, which contains more hyaluronic acid, and then the product will be less liquid, and it's less hydrophilic. This is the MHA 18, which you're gonna see that you see on the slide right now, and of course our a booster of the fibroblasts. This is nutrition of fibroblasts. This is NCTF 135 HA. We will start with the very simple technique, and from one area to another, we will increase the level of the difficulty of our injection. This patient has been applied with. Yes, great.
Repeat the protocol you're going to use for this specific patient you have here?
I didn't announce it yet, so I cannot repeat. The question is, our patient in her 50s, so we have approximately the same level of aging all over the patient, but to be able to show you the most interesting protocols, I will combine some of them. And of course, the deeper the level of the aging, the more stronger product we have to use. And I will start on the neck with so-called, by me, double layer rejuvenation. Why? Because we will increase the level of hydratation in the middle dermis, and we will inject hyaluronic acid, 80 milligram per milliliter hyaluronic acid with glycerol in the middle dermis, and then above we will inject NCTF. I remove anesthesia. We have applied EMLA, 5% lidocaine cream, to be able to provide the best sensation for the patient during the injection. I'm gonna deliver the product with, I'm gonna inject by papilla, and I'm gonna deliver the product with the needle 30 gauge. This technique is really easy to provide. Right now, I inject, the point of injection should be in a distance of approximately 1 centimeter. Yeah?
Excuse me, can you please give us the plan of injection?
Yes, of course. Let me explain you, because I'm sure that all of you are experienced, but probably not in everything I'm gonna show you tonight. So sorry for someone of you who already know this information. Look, please. If I inject my needle and I see the metallic color as you see it right now, it means that I'm in the upper dermis. This is too much superficial for the MHA 18. If I make my injection, introduction of the needle, I lower the needle and I see the location of the needle, but I don't see the metallic color. It means I'm located in the middle dermis. So this is the proper layer for this kind of injection. For all non-stabilized hyaluronic acid. Why? Because exactly here you want to lose your hyaluronic acid in subcutaneous dermis, and you will introduce it on the proper level of fibroblasts. If you inject and then you pull up the needle and you don't see the location of the needle itself, it means you are too deep. Right now I'm on subcutaneous level. So my level should be in the middle dermis. Amount of introduced product is equal to the creation of the papilla, intradermal papilla. This is a small volume of the product. I don't really look on their plunger. I just look on the volume which I create intradermally. And this is it. Distance between my papillas should be around 1 centimeter. The more even you are, the better result you will obtain. Once again, according to the neck treatment, please remember that this is a perfect preparation for the future treatment. This is a great treatment of the aging skin, but also this is a very important as a preventive medicine. As you know, delicate zones, they are challenging because it's difficult to treat them. It's much better to prevent the aging. Don't hesitate to tell to your patient that.
Excuse me, we
Yeah.
have a live question right now.
Yeah, great. Tell me.
Why are you using the cannula instead of a needle here?
I use a needle. Right now I use needle, I don't use cannula.
Okay.
probably I mislead somehow with my perfect English my colleague who asked this question, but for the introduction inside the dermis, we have to use exactly the needle. For the half of the neck, I use 0 or 0.5 product. I inject the rest, and I will continue to work on the neck I change the needle. I see that my patient start to have not lovely sensations, so I change the needle to the sharper one, and we will switch to another product. Can I ask the help to? Okay, it's okay. It's okay. It opens. Just open the needles. The rest of the needle. So I will continue with papillus. And the importance of this technique, of double layer technique, when you introduce hyaluronic acid in the middle dermis and nutrition made by NCTF in a more superficial layer, but also by papillus, is in immediate result and decreasing the level of trauma. Why? Because finally you will have just one procedure instead of two, and I reinforce what I supposed to do with NCTF by injection of MHA 18. Please remember that these papillus can be kept on the skin of the patient during approximately 1 day and a half, up to 2 days. You have to inform your patient about it in advance. You remember everything which we say to our patient before the treatment, this is the explanation. But everything which we say after the treatment, this is excuse. So everything should be explained before. Yep. Yes. Is it... Est-ce que c'était un peu douloureux? Ouais, ça va? So the level of injection of NCTF should be, as I showed to you.
Is it hurting you? How do you feel right now? Comme vous voulez.
It depends on
the zones.
Ouais.
Yes, we have to take in consideration that we are, yes, they are in the evening, so everybody a little bit tired, except of your lecturer, of course. I am full of energy and happy to share with you my protocols. Remember, please, that the injection of the amino acids which are inside the product should be exactly on the, in this case, on the middle dermis. With technique will provide you the best results. Talking about neck rejuvenation, don't
Excuse
forget.
me again, doctor.
Yes.
We have a question from a doctor in the UK.
Excellent.
Question is, are there some counter-indication for pregnant women or autoimmune diseases?
Actually, pregnancy and breastfeeding, and also acute autoimmune diseases or autoimmune disease in acute state are contraindication for all aesthetic treatments.
Okay.
But if we don't know that this woman is pregnant and if she doesn't know by herself, so they will not have any problems.
Thank you very much.
So we shouldn't treat women which are on this excellent stage of their life.
Okay, and sorry, another question, this time from Argentine.
Yeah.
Can you please repeat the quantity that you use for the neck?
Here I do pretty intensive treatment, so I use the whole vial of MHA 18 and 3 milliliters of the whole vial once again of NCTF. Yes, and this amount of treatment allow me to treat not only the frontal part, but also don't forget about lateral part and the upper third. So please don't hesitate to work all over the neck. I wanted to remind you that glycerol, which contains, which we can see inside MHA 18, help us to increase the level of improve the level of differentiations of keratinocytes. So we have double action of this product by hydration and then improvement of the surface of the treated skin. That's why right after the end of the papules and ecchymosis, your patient will declare a very good result. When you treat the skin, don't forget to tell to your patient that the sagging of the skin starts from the face. So even if you use great products and excellent techniques, don't forget to lift up the middle and the low part of the face to be able to obtain the perfect result for the skin of the neck. In case you have platysma bands, don't hesitate to inject make injection of botulinum toxin, but it should be done after injection of NCTF, because of course this kind of strong nutrition will decrease the level of the duration of the botulinum toxin. Let's go to the décolleté. Could you please let me know how many minutes left?
Question just from Belgium.
Excellent.
Is it possible to treat with the neck with hyaluronic acid?
Yes, this is what exactly we did right now. And of course, when you do the treatment like that, then you can inject art filler fine lines directly in the lines to be able to fill it up. And thanks to the cohesive features of the product, you will have less risk of hypercorrection and Tyndall effect compared with other fillers, which is really important. So it's very easy to work for the beginners.
And is it before or after the MHA 18?
First of all, you improve the quality of the skin, and then you treat the horizontal lines. In case your patient can allow you to do the whole protocol. Yeah. And then you're supposed to choose, it's better to choose what you can allow to do from the very beginning. And then to offer your patient best protocol and also the protocol which is affordable for his or her budget. And please don't forget to share responsibility between you and patient, because sometimes patients come to our office and ask us to have the excellent result but for the small amount or not sufficient amount of budget, or sometimes they continue to smoke, continue to have a sun exposure, and then demand from us to have a perfect result just from very first procedure, which is impossible. It's better to explain them before that you cannot do that than to look for excuses after. For the décolleté, I'm going to show you another type of protocol. I will combine art filler fine lines with NCTF, which is very important, but the action of this combination will be a little bit different. I will inject art filler fine lines, but inside the dermis I will put my product on the depth of middle deep dermis. Please remember that this is very important to do it with the proper technique. When you inject the filler, you shouldn't see any papilla. Why? Because right now I keep in my hand the product which is cross-linked. As far as it's cross-linked, any papilla which I create on the surface on the skin will stay visible, which I don't want because it will create it will not satisfy our patient. And idea of injection of cross-linked hyaluronic acid intradermally is to place not only product which gonna hydrate the skin, because these propers will be for these purposes I will use NCTF, but I will put a small drops of cross-linked hyaluronic acid to stimulate fibroblasts, and I will insist on the area where I put the product in case I see wrinkles. I prepare for you another surprise, another technique with Nanosoft, which I'm going to show you on décolleté as well. That's why I distribute my product evenly everywhere, not just on the area. I don't insist on the area with wrinkles, because this is where I'm going to inject NCTF. But once again, my distribution should be done properly. I will ask cameraman to help us to understand. This is a very important what you see right now. If you have any doubts, please pass your hand like that from the put it on the superficial plane and touch. If you feel any papilla, please make it, just press on it immediately. Press on it immediately to distribute the product. In case papilla is not visible and you don't feel this amount of the product, so the level of injection is correct. Please never mix two techniques. Never mix techniques which you saw on the neck and the technique which I show you on the décolleté. Why? Because we use two different products. On the neck, I use non-cross-linked hyaluronic acid. On the décolleté, I use exactly cross-linked. I use exactly opposite product, cross-linked hyaluronic acid. So no papillas should be here. Area of décolleté is a little bit sensitive. I will ask my patient to stand a little bit more. Yes, we can keep some anti-stress balls in the hands. And I will continue with my injection. Don't forget, small drops all over the area. Est-ce que ça va ou pas? C'est douloureux. C'est possible. Okay. Okay. Why these techniques, why I choose this technique and why I like this technique, especially before summer season. This technique, when I inject stabilized hyaluronic acid intradermally, will allow me to see my patients not every 2-3 weeks. Yes, I can do this protocol every 2-3 months. As you see, I already treated almost all décolleté, and I use 70% of the product. When you right now the summer is coming, so some tips and tricks from your patients, from you to your patients, are always welcome. Don't forget to say that the best treatment for the time of sun exposure, this is the introduction of hyaluronic acid and non-cross-linked hyaluronic acid based with glycerol, because this is a great antioxidant protection, and also introduction of NCTF. But except of recommendation of strong sunblock creams, I remind them that they shouldn't have intake of any photosensibilizant during the sun exposure. For instance, they shouldn't drink grapefruit juices because they contain psoralen, which increases the sensibility of the skin to the sun. So like that, we're gonna treat not only the aging of the skin, but also possible hyperpigmentation. And right now I start this introduction of the new excellent tool, the only needle which you have right now in the world with this kind of purposes. This needle has been created especially for Filmed, and the length is 0.6 millimeters. This needle allows us to deliver the product directly intradermis. Please look how the papilla is created. This needle, this concept has been used previously for the vaccination to deliver the product on the proper level. And thanks to that, thanks to this technique, I can show you how to inject without preliminary anesthesia and with an excellent result. So here, to have a perfect treatment, I will use both products at the same area, but you can use it one by one as well. Injection of nanosoft needle require just a little bit training. You have just see it at first, and you should pull the skin. You introduce the needle, and you create a small papilla. This papilla will disappear in a time about 2-3 hours. And when you would like, in case you would like to treat linear wrinkles, you can place these papillas one close to another, so one papilla touch the previous one.
Excuse me to interrupt again. We have a question from Portugal.
Great.
Which
Welcome,
is,
Portugal. Yeah.
what could be the immediate or later complications following the injection?
This kind of injection, or any kind of injection. I think this one, right?
This one, exactly. Sorry, on this zone.
Once you inject NCTF, nothing except of allergy, but we have to prevent it. We have to ask our patient if she has any problems. According to in case we inject art filler fine lines on the proper level, you basically cannot have any problems, because the only problem which you can have, this is a visibility of the product. And in case of proper location, it's just simply impossible. So the techniques which I show to you, first of all, they are more than efficient, and second, they are safe.
Sorry, from Mexico, one doctor was saying, were you saying that with art filler, it's not the same thing?
No. I just said that with art filler, you're completely secured if you follow our protocols and inject products on the proper level. That's it.
Thank you so much.
Yes. Allergical reaction, yes, is possible. But in case you know that your patient is allergical, just start with simple hyaluronic acid. Don't introduce NCTF in this case. If the patient allergic, for instance, for any kind of vitamins or other ingredients which this patient met in their private life, start with hyaluronic acid. Okay.
Thank you so much.
I'm almost finished. As far as just let me know how many minutes we have until the end, because then I will, of course, I will inject. I will treat all the décolletage, but having a very limited amount of time, I keep some products for the
end. Yeah.
For the end, when we want to see any. Then I have a free time, and I will explain you everything I wanted.
Okay, so we have 25 minutes left.
Okay, great. 25 minutes until the
end.
Until the end. So we have to keep some time for the questions.
Yeah, but like you see, we can interrupt you as well.
Okay, excellent. So for the hand. When you look for the hand, here you will see the grade of the aging, which doesn't suit for the grade of the aging for the neck and décolleté. The hands are really well kept, let's say, and you don't see a lot of dark spots. The level of fat is not as bad as it could be. So here I will use the technique which will prevent the future aging and improve the quality of the skin and the quality of the fat. I will use 2 products, but I have to use a proper amount of the product. I will use 1 milliliter of art filler fine lines for each hand, and once again I will combine this product with NCTF. We cannot wait a really proper result once we don't give nutrition to our fibroblasts.
Question from Hungary.
Yes.
Is the area of the hand dangerous in terms of injection?
It depends how you inject. As I didn't include in my presentation the slide, but this, first of all, you see some of my data on the screen, and then you can ask to provide you the special scientific data where it's explained that injection with cannula on the back of the hand will provide you not only the safe result, and not only efficient, but also the safe result. We have to work on the upper subcutaneous fat, just below the skin. And I will show you how we find this plane. So the only way how to work properly, this is to work with cannula. In case you are, for any kind of reasons, don't work with cannula yet, I will show you how to introduce the product on the proper level. But once you know where is cannula in your office, please use it. We will introduce fine lines in subdermal layer by cannula. I choose the place of injection which will allow me to reach the farthest zones. So it will be here, just above the wrinkles, but a little bit left to the veins. I make a small injection. I lift up a little bit the skin. Probably it's not visible. I lift up the skin, but the direction of the pinch should be as a direction of the cannula.
Question from Poland.
Yeah.
Is there still risk for hematoma?
In case you touch the vein, yes. I prefer to use for the hands the cannula which has a size more than 25. Like 23 or 24 gauge. Why? Because the thicker you are, the less risk of trauma you have. So let's discuss about the proper level of injection. Right now I'm located just below the skin. Once you can move the cannula, like I show you, it means we locate it in the proper level. If in case you cannot move it like that, you are a little bit deeper. I introduce the product with a small linear injection, and I will fill up the areas which are lacking of the volume. And of course, I will distribute with a small massage the product.
Quick question from Sweden.
Yes.
Do you use any anesthetic products before injecting the hand?
Here I use it, but normally, actually, it's here we use it for the presentation. But in my daily practice, once I work with fine lines or universal, not. Why? Because the point of injection is not really painful, and the product itself contains lidocaine. So introduction of the filler itself will bring anesthesia.
Thank you.
Okay, don't hesitate to go close to the fingers. And the most important for us, this is even distribution of the product. We don't have really visible absence of the volume here, so we distribute it evenly. In case you see it, insist on these zones. Up. I go forward. Some tips and tricks for the hand treatment, for the post-treatment period. This kind of injection, just because of trauma, can bring edema for the day after, and not only for the hands itself, for the back of the hand, but also for the finger. So remind your patient to remove all their rings for 1 or 2 days, so not to be stuck on the hands at this period. For my patient, as far as I would like to show you different protocols, I will use the next syringe, and this syringe is NCTF, and I will introduce it from the same hole, and I will distribute it all over the hand. Why I do it? I do it, first of all, shouldn't be painful anymore because I make anesthesia by fine lines. Then it will help me to deliver product close to the deep dermis and to help the better distribution of articular fine lines as well. I don't mix it in one to be able to keep the same rheologic features. And this is one more technique. You can find this description of this technique when you type BioNutriLift.
Quick question again,
Yeah.
from Greece this time.
Yes.
How long after do you see your patient for a follow-up?
How often? What?
After you do the treatment,
Yes.
how long does it take for you to book the next appointment for a follow-up?
Depends on the protocol. I didn't discuss with you the the interval between procedures. Why? Because we use 3 different protocols all over the body. But the logic is here. The longer lasting product you inject, the longer should be intervals between injection. In case you use MHA 18, you can keep keep doing procedures every 3-4 weeks. In case you do as a basement injections of fine lines or universal, it can be the last procedure in a cycle of procedures, or it can be the first procedure and the second one will be repeated minimum in 1 month and maximum in 3 months.
Okay, and now we've been having the same question over and over. Could you please show us the difference between the treated hands and the knots?
Of course.
Thank you.
Of course. Okay, and what we're supposed to do, I ask my patient, it's visible, yes? I ask my patient to I put the position of the hand like that, and I distribute evenly. Relax, please, relax. So you see the difference? This was the light treatment. We didn't fill it up. And as I told you, our patient didn't have an extreme loss of the volume of the back of the hand. So right now you see that this procedure is not really aggressive, and your patient can hide it from the society.
Very impressive results.
On the other hand, I will show you the both products, but I will introduce the fine lines by cannula, and injections will be done by needle intradermally. Why I show you these 2 techniques? For this patient, it's better to use introduction by cannula of both products because she has rarely good quality of the dermis. But in case of thin dermis, it's better to bring more nutrition for the fibroblasts by intradermal injections and to stimulate creation of new collagen also by mechanical introduction of the product.
Another question from Mexico.
Yeah?
Just would you use the same protocol if it was a man instead of a woman here?
In case of a grade, in case we will have a grade of the aging which is equal, yes. But remember that men are more lucky than us, women, Why? Because they initially have more collagen in the skin. It's 25-30% more approximately. So the protocol you should adapt according to the of the thickness of the skin.
Okay, and from Belgium, what is the size of the cannula that you use?
It's very easy to guess. And once you see that the hand of the cannula or any conductor is blue, it means this is a 23. Once you see the orange color needle or cannula, it means this is a 25. So my cannula, this is a 25. I continue with fine lines, introduction of fine lines. The proper level, this is the most superficial level of introduction. The most superficial level of the fat. Up. No, it's okay. Thank you very much. Merci pour votre aide. I just go very delicate, having very prominent vein here. I pass through it. I go above, up, and actually having these kind of techniques, we don't risk. We lower the risks of side effects. Let me show you. I have just 0.3 milliliter left, and I show you the same level of introduction of the product, but in case you don't have a cannula. Of course, I advise you to have filmed cannulas, because we have a special cannula 55 millimeter long. But let me show how to do it without camera as well. This is a so-called tent technique. What we do, which camera is working right now? I suppose, or it's better, probably this side. So what we should do, you lift up the skin. You lift up my head, sorry. It's better to use camera free if we can. No, we cannot. Yeah, voilà. Thank you very much. So I lift up the skin and I make an injection of like 30% of the needle, and I inject about 0.1 or 0.05. So I have a small papilla which is located on the upper dermis, and I just pull on it. Once again, I pull the skin, I put my needle in the middle of this tent. I inject the small amount, 0.05. I remove. You have this papilla, and then you push. The question is, then you push the product. It goes deeper in the fat. So it's better to have a distribution of the product by cannula, once again, rather than like that. But we have different situations in our life, and I would like to be useful, and I would like that my workshop will be as useful for you as possible. Here, this is a papilla. Once again, we make distribution. So there is no papilla, there is no future visibility of the product. And I will continue with intradermal injection by 30 gauge, or it can be 32 gauge needle.
Quick question.
NCTF. Yes,
from
please.
Italy, please. How much does it cost, this treatment, just for the hands?
It depends what kind of product do you use and how many product do you use. So count, but usually, as for the body, as for the injection of botulinum toxin for the hyperhidrosis, I charge less for 1 unit compared with the unit for the face. I don't want to announce the price, because we have absolutely different doctors from different countries. We have doctors from different countries.
Thank you.
But I decreased the price of 1 milliliter approximately for 30% compared with the face.
Thank you very much.
I think this answer will give you approximate
range.
Range, yes,
Thank
for
you.
what we have to do. At the end of the treatment, we apply recovery cream which will help us to prevent infection. We tell to our patient not to apply any cosmetic product. Don't go under, don't use a sauna or bath for 3-4 days. Of course, shower is allowed. And don't do any manipulation by hand, which can lead to local infection. The even distribution of the NCTF is welcome. Why I do these jumps from one injection to another? Because this is the end of the workshop, my patient is tired and I feel it. So to not create more stress in her body, and once again to avoid the trauma of the vessel, which is vessels and vein at this patient are really well presented and superficial. One more bonus for you, and to force you to use a cannula and subdermal introduction of stabilized hyaluronic acid. According to the one of last scientific research, we know that the introduction of hyaluronic acid of subdermal area help us to prevent the aging of the fat, which is really important for the face. Why? Because we have atrophy of the fat, and will help us also to stimulate the collagen. Yes, my time, it seems like, is over. So I feel like a Cinderella right now.
Almost.
Almost. I didn't lose any shoes, but I'm going to lose your attention. But let's meet not in online, but also offline. So welcome to all scientific events all over the world, and of course, once again, in Sibley formation. I apply Filorga, a free recovery cream, to finalize the results.
Thank you so much, doctor. Very clear explanation, and thank you to all. Thank you all for following us tonight, and thank you for being so active on our live chats. If you want to meet us again, our next live session is going to be next Tuesday on May 28th. Thanks again, and have a great evening to all.
Bye-bye to everybody. До свидания. See you soon. Au revoir.
Thank you.
Thank you. This is the most pleasant part.